Another approach to tuberculosis is you are trying to look at the site of the infection, right? So we said that tuberculosis is a disease condition that primarily it affects the lungs. So you call that what? A pulmonary tuberculosis. Now, if tuberculosis is now spreading to other organs, it's known as what? Extrapulmonary tuberculosis. So in this video, we're just trying to talk about the differences. If somebody say pulmonary tuberculosis, what do they mean? If somebody say extrapulmonary tuberculosis, what do they mean? All right, so differences between the two concepts. All right, so extrapulmonary and pulmonary tuberculosis. So say that there are two main types of tuberculosis that can occur in the body. One is the pulmonary tuberculosis. The next is the extrapulmonary tuberculosis. So let's define them. After we define everything, you guys will get to know the differences between the two concepts, right? So that the pulmonary tuberculosis, this is the most common type of tuberculosis, and it occurs in the lungs. So if tuberculosis is just at the level of the lungs and not start spreading to other parts of the body, we say that it's a pulmonary type. Now, this type of tuberculosis is contagious, mostly when the person coughs or the person talks near you, so the spores land on yourself, okay? So the symptoms of pulmonary tuberculosis include persistent cough for 3 weeks or longer. The person can be coughing with blood, that's hemoptysis. The person can be coughing with phlegm. The person can be having severe chest pain. The person can be having difficulties in breathing, that's a shortness of breath. Then, moving to the extrapulmonary now, tuberculosis. Extra, outside the lungs, right? So this type of tuberculosis occurs outside the lungs and can affect other parts of the body such as the bones, organs. Symptoms of extrapulmonary tuberculosis depend on the part of the body that's affected, all right? So if the lymph nodes that are affected, the symptoms are there. If it's the bones that are affected, the symptoms are there. If it is a liver, it's the gastrointestinal system. If it is causing meningitis, so different types of what? Extrapulmonary tuberculosis that we have. So for examples of these symptoms, if it's affecting the lymph nodes, you say that it's tuberculosis, what? Lymphadenitis, okay? There's a swollen lymph nodes, the person will be feeling feverish, be feeling weak, be having some weight loss that I can't actually explain for, and be having night sweats, right? Then skeletal TB, that's affecting the bones, right? So be having severe back pain, having stiffness, that's of the bones, be having some swelling, abscesses, and bone deformities might all be present. Then miliary tuberculosis, these symptoms vary depending on the organs affected, right? Genitourinary, you'll be having testicular swelling, painful urination, decreased or interrupted flow of urine, and pelvic pain. For the next one, see it. Right, to other parts. Okay, this one's other parts of the same lung. So it can affect the adrenal gland, can affect the bladder, can affect the genitourinary system, can affect wherever, right? That's when you say it's extrapulmonary. Then for the liver tuberculosis, this one is what? The person will be having a high-grade fever, upper abdominal pain, liver enlargement, and jaundice, right? Then if it is affecting the gastrointestinal tract, gastrointestinal tuberculosis, abdominal pain, loss of appetite, weight loss, change in bowel habits, and nausea. Then if it is causing meningitis, that's inflammation of the meninges, definitely headache could be there, right? So aches and pains, fatigue, loss of appetite, persistent headache, low-grade fever. If it is causing a peritonitis, that's inflammation of the peritoneum. It will cause accumulation of fluid in the abdomen. That's what ascites. It will also cause a fever in you. So if it is causing pericarditis, that's what? Inflammation of the pericardium. It will cause things like what? Chest pain, fever, palpitations, shortness of breath. Then cutaneous tuberculosis, it will cause sores, lesions on the elbows, hands. You'll be having lesions on your buttocks, even behind the knees and feet. So talking about the organs that can be affected, just examples of organs, spleen, like the summary, organs that are mostly affected for extrapulmonary, okay? Spleen, liver, lungs, your bone marrow, your kidney, your adrenal gland, your eyes. These are the organs that can mostly be affected in extrapulmonary tuberculosis. Why the pulmonary tuberculosis? They're just simply talking about the lungs, right? So these are the differences between the two concepts.